Hi friends, welcome back to Happy Nursing. Sorry for the delay. I had some involvement which caused this late upload. I apologize for that. So this is Ila and today we will discuss about the goal attainment theory given by Imogene King. This theory was first introduced in 1960. The main concept of the theory is nurse and patient go hand in hand in communicating information, set goals together and then take actions to achieve those goals. Imogene King defined nursing as a process of action, reaction and interaction by which nurse and client share information about their perception in nursing situation. Let's consider a patient has come to a hospital with a fever and he is being attended by the on-duty nurse. This is the nursing situation. What will happen first? Both the nurse and patient will talk to each other. The nurse will ask questions. What is your problem? From when did it start? Have you taken any medicines, etc., etc., and the patient will reply. So there is a sharing of information. So there is a set of action for the nurse. Checking vitals, taking history, making assumptions. She may say, it seems your symptoms are the result of dehydration. Giving advice. All these are the actions taken by the nurse. The patient gives his full history. What are his chief complaints, even his perceptions. I think this is normal, sister. It often happens to me. These are the patient's reactions. So in the process, an interaction takes place between the nurse and the patient where they share their own perceptions and information about the patient's health, right? Again, King has defined nursing as a process of human interactions between nurse and client, whereby each perceives the other and the situation. And through communication, they set goals, explore means and agree on means to achieve those goals. So now information has been shared, interaction has been started, perceptions are also shared. What else is remaining? Each should perceive the other and the situation. The perception must be clear. The nurse has to make the patient understand that the fever is causing dehydration and that's why the patient is getting some specific symptoms. It's not without any reason. And the patient should understand that this has happened very often to him and the reason is this. It's not just like that. So perceptions are clear. See, it can be other kinds of situations also. I have chosen this example, so I am going with it. It will be easier for you to follow. Now, after the perceptions are clear, goals should be set mutually. Mutually means both should agree. What should be the goal here? The fever cannot continue, right? So the goal here is to maintain normal body temperature, or from the dehydration aspect, the goal can be to maintain adequate fluid balance. Next, to achieve these goals, means are needed. Patient may get IV fluids, antipyretics, some investigations may be needed. All these are means to achieve the goals. These means are informed to the patient and the patient should agree to that. Actually, both should agree. Suppose the patient said he doesn't want an IV line, he wants to take oral. So, if it's possible, permitted by the physician according to the extent of dehydration, it can be done. So, the nurse and the patient communicate and set goals, decide means to achieve them and agree to the means. Now, according to this theory, there are three kinds of interacting system: the personal system, the interpersonal system and the social system. Each of these interacting systems has their own concepts. The personal system concepts are perception, self, growth and development, body image, space and time. The concepts for the interpersonal system are interaction, communication, transaction, role and stress. The social system concepts are organization, power, authority, decision making and status. First, we will discuss about the personal system. Personal means which is exclusively mine, not anybody else's, right? My personal file, personal diary, personal space, personal life, where nobody else is allowed. So, everybody has a personal system, whether it may be a doctor or a nurse or a patient or some other person. So, the main focus here is the person. Now, what are the concepts of a person within himself or herself? First one is perception. Perception is the way in which something is understood through the senses. Our senses are to look, hear, smell, taste and feel, right? These are our senses. Whatever we understand through our senses is our perception about a place, person or a system. For example, hospitalization is very scary for some people. Why? If you ask them, they may say, I have heard doctors and nurses are very rude there. I went to a hospital and it was very smelly and dirty. Food was very horrible. So all this information are collected through the senses, and through those information the perception comes out, hospital is not good. Now it may be different for others. Say a person have seen or heard just the opposite things. Then his perception about hospitalization will be different, right? So it differs from person to person. Next is self. King defines self as a composite of thoughts and feelings which constitute a person's awareness of his individual existence, his conception of who and what he is. We studied the self concept in Roy's adaptation model, remember? It's almost the same. What is my own thoughts on myself? How do I see myself? My feelings about my physical self and personal self. I should be aware of what I am or who I am. Suppose I know that I am a nursing professional and right now I am helping others to pursue their career by assisting them in understanding some important concepts of nursing. So I am aware about my own self, that is myself. Now if I say that I am the Prime Minister of India or I have appeared in the world for some greater good, then I am not aware of my own self, right? Next is growth and development. It is defined as the process in people's lives through which they move from a potential for achievement to the actualization of self. It is something which is both physical and mental, and it also differs from person to person. Here we are talking about the personal self. So obviously everything here is about one's own personal system. Like a child may speak clearly at the age of 2 years. Some may speak late. That is a developmental delay. Some people are very tall for their age. Some are very short compared to their age. Some have the perfect height and weight according to their age. All these are physical aspects. Again, we may take the example of emotional maturity. Sometimes we see some people are very matured. They can handle everything coming in their way. Working, helping others, facing crisis in life, still supporting others. An immense level of maturity they have. On the other hand, some may be so afraid of situations, running away from them, overthinking, overanalyzing, being anxious. They are very fragile. Why? Maybe due to age, maybe due to life experiences, maybe due to their environment. Some have supportive families, some don't. Maybe due to genes. Parents are mentally very strong. The son or daughter has got their genes, so they are also strong. So growth and development differs from person to person. Next is body image. King defines body image as to how one perceives one's body and others' reactions to one's appearance. Here are two things. First is how one perceives one's body. How do I think how I look? What is my perception about my own body? I may think myself as a healthy woman, looking quite okay and even beautiful. But another thing is others' reactions to one's appearance. How others are looking at me. How are they reacting looking at me? Suppose someone daily comes to me and says, you are looking very fat. You don't look good. Please lose some weight. Then what happens? My own body image to myself may change. I may think, yes, I have to lose weight. I am really fat. So my body image depends on both on my perception and others' reactions according to the goal attainment theory. Next is space. Space is defined by the physical area known as territory and by the behaviors of those occupying it. We have often heard like I need some space, right? Space is like a comfort zone which varies for different people. Some patients may share their problems easily with doctors and nurses. We have often seen such patients who talks about their life, share their stories and can mingle easily, maybe due to their upbringing or their environment in home and workplace. And some may be very shy. They don't want to tell you about your problem. They usually take some time to come out of their comfort zone. After a few days, they may talk to you. So they have a different kind of space. Now, why are we calling it territory? Because it's like their marked area where they are safe or where they feel safe. For example, a patient may be very friendly to you, but suddenly a new nurse goes to take care of him and he is again back to quiet. That means he has limited his space. The nurse will need some time to enter into the patient's territory. After a few days of meeting him regularly, the patient will open up, talk to her, be friendly. That means the nurse has finally got into his territory, his space. Next one is time. Time is defined as a duration between one event and another as uniquely experienced by each human being. Means it is the duration between two events, but it also differs from person to person. Here I will use an interesting example from my experience. I am sure most of you have experienced events like this. Suppose a patient is calling you for something. You took 2 to 3 minutes to respond. You were actually doing something, you finished up and went to attend the patient. The patient told you he had to ask you for some information. He asked you and you gave it. Your work is done, you left. Again you may see another patient calling you for the same reason. Again you attended the patient within 2 to 3 minutes. But this patient shouts on you like anything. Do you have any idea how long I have been calling you? Why are you so late? I will inform to higher authorities, this and that, etc. etc. What happened? You attended both of them in precisely 2 to 3 minutes. Why are the reactions different? Because the perceptions of time differs from person to person. That 2 to 3 minutes is nothing to someone, and that same 2 to 3 minutes seems like a long time for another person. It also depends on various situations and experiences. Suppose a patient is being discharged after 1 week after a very smooth treatment course. He didn't have much complications. Symptoms were easily relieved. Another patient may suffer so much in that time period that even after getting discharged, after the same duration, that 1 week may seem like a long time to him. So that was all about the personal system. Next comes the interpersonal system, which we will be discussing in our next video. Before ending today's video, let's recapitulate once again what we have gone through today. Imogene King has given the goal attainment theory, where she has defined nursing as a process of action, reaction and interaction by which nurses and clients share information about their perception in a nursing situation. She also said nursing is a process of human interactions between nurse and client, whereby each perceives the other and the situation, and through communication they set goals, explore means and agree on means to achieve the goals. There are three kinds of interacting system: the personal system, the interpersonal system and the social system. In the personal system, we have the following concepts. First one is perception. It is the way in which something is understood through the senses. Self is the composite of thoughts and feelings in which constitutes a person's awareness of his individual existence, his conception of who and what he is. Growth and development is the process through which people move from a potential for achievement to the actualization of self. Body image is how one perceives one's body and others' reactions to one's appearance. Space is defined by the physical area known as territory and by the behaviors of those occupying it. And lastly, time is the duration between one event and another as uniquely experienced by each human being. I hope the concepts are clear to you. If you like studying with me, please like and share my videos and